Alright, in this last part of the lecture, what we're going to do is look at the three main tracts that we're going to first talk about here in this course. Over the next 5 weeks, we're going to learn about a lot of different neural networks. And that's important because if we understand where those neural networks are and how they cross and where they live relative to one another, then we're going to be able to use that information to pinpoint exactly where a patient's symptoms are coming from. In the first application session, for example, in a couple of days, we are going to look at patients who have numbness and weakness and try to figure out where in their nervous system their numbness and weakness is originating from. So in order to know that, we need to know where strength comes from, how do we control our motor system, and how do we control our sensory system. As I've alluded to already, there is one motor tract that travels from our motor cortex down our central nervous system through the peripheral nervous system to our muscles, and two sensory tracts that bring sensation up from our body up to our brain. This is an illustration of the motor system. We're going to look at it in this image, and then we're going to look at it in our three-dimensional image so you can get a sense of it from two different perspectives. We're going to start up in the cortex, in the motor cortex, and it is organized in the shape of the homunculus, which is what we call the little person who lives in our motor cortex, in our primary motor cortex, where the face is innervated here, the hand is innervated here, the body and legs are innervated down the center. All of those motor controlling neurons bundle together, and their axons collect here in the internal capsule and travel together as a unit down through the brainstem, illustrated here in the midbrain, through the pons and down into the medulla. And you'll notice that they travel anteriorly in the ventral aspect of the brainstem, very far forward and in the cerebral peduncle and in the medullary pyramids. Here you're going to notice that the motor tracts cross over at the bottom of the pyramids in the medulla. We call this the decussation of the pyramids, or the decussation or crossing over of the corticospinal tract. The corticospinal tract then continues down on the other side, down the spinal cord, right? And it's going to synapse at the level of the spinal cord that controls that part of the body and goes out to the skeletal muscles. Okay? So a couple of really important features of all the tracts that we're going to learn on from here on out, and this is the first time we're seeing it, is that we have to pay attention to where that tract crosses over in the nervous system. Every tract crosses in a different spot. And that's really important because if we injure a tract after the crossing over happens, or below where the crossing over happens, then the injury will be on the same side of the body as the symptoms. I'm going to say that again. For example, if you have weakness on the right side of your body, that can be due to injury of the motor tract on the same side of the body as the weakness is. Or if it's above the crossing over, you're going to have an injury on the opposite side of the nervous system to where the weakness is. Okay? And we're going to see that happen over and over again. That wherever there's a decussation, a crossing of a tract, if you have an injury to the tract below where the crossing over is, then the injury and the weakness will be on the same side. And if you have an injury to the tract above the crossing, then you will have weakness opposite to the side of the injury, or contralateral. Okay? That's where the terms ipsilateral and contralateral will be applied. Let's look at the corticospinal tract here. The corticospinal tract, again, is that main motor tract that we were talking about. It's called corticospinal because it starts in the cortex and goes down to the spine. We have two neurons, an upper motor neuron that goes all the way down from your cortex down to the spinal cord level, and the lower motor neuron, which goes from the spinal cord level down to the peripheral nerve. We're going to start here in the cortex, in the primary motor cortex. Let's say here we're innervating our hand. It's going to go down, projecting through with the white matter tract here in the corona radiata, which is this area of white matter. The axons are going to continue down through the internal capsule here in the deeper brain. Those white matter tracts are going to continue down through the midbrain, in the anterior midbrain, in those cerebral peduncles. It's going to continue down through the anterior pons, through the pyramids of the medulla, and then we are going to, these axons are going to go down here and cross over here in the lower part of the medulla. Okay? And then, once they come here to the lower part of the medulla, after that decussation and crossing, they will continue downwards in through the spinal cord. Once they have crossed, if you injure the corticospinal tract, it will be injured on the same side as the weakness will be. Let's move on to the next image and see what's going to happen down in the spinal cord. Okay? Now, the corticospinal tract is descending down the spinal cord, and at every level of the spine, in the cervical spine, it's going to give off axons that will control the arm, but the axons that are going down, down, down towards the legs will continue on in the corticospinal tract, right? So at this level, let's say we're in the arms, the axon that peels off here will synapse here in the ventral horn onto the lower motor neuron. So the upper motor neuron that controls the strength in this person's hand will peel off and synapse here, and the lower motor neuron that's going to come out through the anterior ventral motor nerve root is going to go out into the peripheral nerve into the arm, while the upper motor neurons going down into the legs to control our leg strength will continue on downwards. Okay? Now, we're going to zoom out and look at that lower motor neuron pathway that goes out into the peripheral nervous system. We have exited the spinal cord, and the lower motor neuron travels through the peripheral nerve and synapses onto the muscle that it controls. And this is the end of the motor system. So just to summarize, we have two neurons. It's a two-neuron system. The upper motor neuron that goes from the cortex to the spine through this corticospinal tract, which crosses in the bottom of the medulla before continuing down ipsilateral to the muscle it controls. It synapses right here in the anterior spine, in the ventral horn, in the gray matter. It exits through the anterior nerve root and goes down the peripheral nerve to the skeletal muscle. Now, let's talk about the last two tracts that we're going to focus on in the first week, and talk about the sensory tracts. There are actually two separate sensory tracts. One of them brings up pain and temperature sensation, and that is this one here, which is called the spinothalamic tract. And another tract brings up vibration and proprioception. They both start out in the skin. The lower sensory neuron, or the primary sensory neuron, comes up, and its cell body is in the nerve root. The nerve root comes in through the back. Remember how sensation is generally more posterior and motor is generally more anterior. That sensory neuron is going to come through the posterior nerve root. And at this point, the neurons that carry vibration and proprioception, or position sense, are going to split off from the neurons that are bringing pain and temperature. Let's focus on the vibration and proprioception fibers first. They are going to go up without synapsing yet, and to go through the posterior column, or the dorsal column. That's the name of this tract. It's going to go up the spinal cord on the same side, ipsilateral to the side of the body it controls, all the way up to the base of the medulla, where it will synapse in the nucleus gracilis and cuneatus. That's the name of the nucleus where the first synapse happens. So in other words, this sensory neuron goes from the tip of your toe or the tip of your finger all the way up through the nerve root. Same axon goes all the way up to the base of your brain, one cell. Okay? It's going to synapse here and finally arrive at the second order sensory neuron. It will also cross at the base of the medulla, just like the motor tract, the corticospinal tract, and then will travel up the contralateral brainstem up to the thalamus. The tract here is called the medial lemniscus, which we talked about a little bit when we were looking at the brainstem. So this primary sensory neuron traveled up the dorsal column and now synapsed and is continuing to travel up the contralateral medial lemniscus, which is why the dorsal column system is sometimes called the dorsal column medial lemniscus pathway. It synapses in the VPL, or ventroposterior lateral thalamic nucleus, and then projects up the corona radiata to the postcentral gyrus, where it synapses in the primary sensory cortex. So here, as opposed to the motor system, there are 3 neurons. One, which continues up to the medulla. The second one, which decussates and crosses over, goes up to the medial lemniscus to the thalamus. And the third order neuron, which travels from the thalamus to the cortex, primary sensory cortex. The spinothalamic tract is the sensory tract that carries pain and temperature. It goes up the dorsal cell, past the dorsal nerve root, and synapses here at the level of the spinal cord. So that's a big difference between the pain-carrying neuron and the vibration proprioception-carrying neuron. The pain one synapses here in the gray matter of the posterior horn, or the dorsal horn. It crosses here through the anterior white commissure and crosses to the opposite side of the spinal cord and brings up sensation through the spinothalamic tract, a single neuron that goes up from the spine to the thalamus and is called the spinothalamic tract. That is separate from the medial lemniscus and from the dorsal column, right? And so it goes up, straight up, without decussating, because it's already decussated here at the level of the spine, the spinal cord where it entered, and it also goes up to the VPL nucleus of the thalamus before sending its third axon up to the primary sensory cortex. So just to summarize, the biggest difference between the dorsal column sensory pathway, which carries vibration and proprioception, and the pain temperature pathway, the spinothalamic tract, is that the spinothalamic tract crosses over at the level that it enters the spinal cord, while the dorsal column medial lemniscus pathway stays ipsilateral as it goes up the spinal cord and only crosses over once it gets to the base of the medulla. And this will be important when we are trying to figure out where someone's injury is, because these two pathways are on the opposite sides of the body as compared to where they innervate. So let's look at this now in situ, in the body. The peripheral nerve carries up sensation that comes from the skin, goes up the peripheral nerve through the nerve roots, and this time enters the posterior nerve root. It's going to go up the posterior nerve root and enter here, and this is where the sensory neurons will split up. The large fiber sensory neurons that carry pain and temperature are going to go through this into this nucleus, as demarcated here by the darker symbol, and will synapse here, cross here in the anterior commissure, and go up the spinothalamic tract on the opposite side. So that decussation happens here at this level, and it's going to go up from here, straight up, contralaterally, to the thalamus. Okay? The large fiber sensory neurons that carry vibration and proprioception are going to go straight up the dorsal column without synapsing. And they're going to go up to the base of the medulla where they will synapse. Okay? One thing that I want to point out here is that if you look very closely here at the nerve root, you're going to notice right here is the cell body of both of those sensory neurons, the dorsal root ganglion. Okay? So that's where the cell body of the sensory neuron lives. Finally, we're going to go up and zoom up to the brain stem and the thalamus. Down here at the bottom of the brain stem is where the primary somatosensory neuron carrying vibration and proprioception finally synapses after it ascended from the dorsal column in the nucleus gracilis and cuneatus. Here is where it will cross over and go straight up the medial lemniscus pathway. It's going to travel up the medial lemniscus pathway and finally synapse here in the ventral posterolateral nucleus of the thalamus. And the third order neuron will finally travel up through the corona radiata to the primary somatosensory cortex. The other pain and temperature pathway already was on this side of the spinal cord and will travel up this side of the brainstem through the spinothalamic tract and will also enter the VPL nucleus of the thalamus. Finally, these two tracts will be joined together again and will ascend up the corona radiata to the primary sensory cortex, once again united. This time organized not by sensory modality of pain and temperature versus vibration and proprioception, but instead together organized geographically by the part of the body that they innervate. Those are the three nuclei that we're going to need in order to understand how to begin to localize in our first application session. So I want you to learn those three pathways, and I want you to use these images as well as this resource in order to be able to learn that. These are the two sensory pathways, and the images embedded here are the motor pathways. So you're going to be able to use those and put them all together. I want you to draw them out. I want you to know them well enough so that when it comes time, you're going to know where they cross and where your symptoms will be relative because of that particular injury to the nervous system.